what we observed for heifers is that they actually had about 5% decrease in their conception rates during that 2024 from March until December. But that appears to go back up in 2025. So it perhaps maybe was just a short term. But also interestingly with that is that for heifers, we saw an increase in services per conception, but they've remained higher. So on this one herd in particular, they went from, about a 1.5 up to like 2.2 number of times bred for their heifers, and it's continuing into 2025.
Good day and welcome to the Dairy Podcast Show. This is Mark Thomas connecting, and it's a great pleasure today to have two guests with us, both from Texas A&M, but similar positions and roles, but at different areas of the state. And we have with us both Dr. Jennifer Spencer and Dr. Juan Piñeiro that are joining us today. So welcome.
Thank you. It's a pleasure to be here.
Thank you. Good afternoon, Mark.
So welcome. So it's great to have two of you here with us. And we're going to talk a bit about highly pathogenic avian influenza today and its effect on dairy cattle reproduction. But before we get started, Jennifer, can you tell us a little bit about yourself, where you're from? How did you get to Texas and in your current role?
Yeah, definitely. So my name is Jennifer Spencer. I'm with Texas A&M AgriLife Extension. So I have mainly an extension position, but I have a 25% research appointment. I started here back in 2018. And before then, I did my education up at the University of Idaho. And I focused on dairy cattle reproduction and reproductive management strategies.
Excellent. And day to day, what are you generally doing in your role?
Well, that's what I probably love most about my job is that then every day doesn't look the same. But we do, a lot of programming for producers. We work with youth, teaching youth about dairy and dairy career opportunities. And then we've been working a lot on, research around Texas. I know Dr. Piñeiro's been doing, some of the drought tolerant type of crops, and we deal with like heat stress type of mitigation strategies or getting numbers for that for the state. But mainly it's what I think we both do is we work with the producers and for the producers, which I enjoy.
Excellent. So lots of real life, real world examples day to day.
Yeah.
Oh, excellent. And Juan, originally from Argentina, now in Texas. So what's a bit of your story?
So first of all, thank you for the invite. As you mentioned, I grew up in Argentina, finished veterinary medicine over there in 2012, came to work in dairies in 2013, worked 6 months in dairies in Texas, then another 6 months in Colorado, and then went to Ohio State, did a master's and PhD over there. And then I started working also for Texas A&M University in July 2018.
Excellent.
Yeah, same position as Jennifer, extension dairy specialist. I don't have the official research component, but I still do some applied research. And as Jennifer mentioned, most of it has been focusing increasing digestibility of sorghum silage because of water scarcity issues. But I'm also helping Dr. Spencer with this influenza H5N1 impact in repro as well, which is a project that she's leading as the principal investigator.
Adiseo, a global leader in nutritional solutions and the provider of Smartamine N, the best-in-class rumen-protected methionine product for dairy producers who want to optimize milk production, capture more value from their components, and maintain their lifetime performance of their herds. For more product information and to calculate your return on investment when you balance your feed with amino acids, go to milkpay.com.
So obviously, bird flu, quite devastating to the dairy industry and various industries. I'm originally from Northern New York and at least officially, no recorded cases in New York, which is actually really interesting, right? How it really affected some states and not others, and others potentially not at all. Here down in Mexico, at least we haven't seen any type signs nor confirmed cases. We'll see as migration of birds come south for the winter. But let's dig into this topic. So how did you? Obviously, I should say, how did you first become interested in this? Obviously, for very specific reason, but this relationship of the virus on reproductive performance.
Yeah. So we kind of thought of it because we know that when cows get sick, they shift their energy towards fighting an infection rather than reproducing. So we kind of thought if that's happening, and if these cattle that are infected with HPAI are having reduced milk production, reducing feed intake, rumination, then there's high probability that it's impacting reproductive efficiency and their performance. So we were thinking, maybe we can look at records before and then kind of during and after and see if there's any like lasting effects or how it may have impacted it during an HPAI outbreak, because we really want to know if it does impact reproduction. We want to let the producers know so they can understand if they might have to cull heavier to make sure that they're managing these and replacing the cows in a timely manner. So for, sustainability of the herd, and also help to maintain or improve their profitability.
So can you explain a little bit more exactly how you're digging into this project? What data, sampling, et cetera, to uncover this effect?
Yeah, so back in March 2025, we actually got funding from the USDA APHIS VS through a rapid response proposal. And so what we are doing is that we're looking at data from 2021, January, until they had an HPAI outbreak. Now, how we're determining that is based on not just what the producer says the date that they were infected, but we're looking at the records and looking for that drastic drop in milk production, because that's kind of the overall sign that when they had a HPAI outbreak, and then we're kind of comparing the average of those reproductive parameters like conception rates, number of times bred, with the during and post HPAI infection to see if possibly afterwards they have a reduced reproductive performance, and if they may be coming back up. So it was only like a short period of time that it impacted those cattle.
Is this research is focused in Texas, or are you looking outside of the state also?
Oh, yes. So we're looking at 3 big dairy regions. We're looking at South Central, and then West, and then Pacific Northwest, because we want to get kind of some information not only about maybe the environment. Mainly it's just the geographical differences and what they deal with heat stress wise, or the feed availability, to kind of compare these and kind of get a 30,000 foot view of what is happening, not just in the region, but overall on the west side of the United States.
So what are some of this project is ongoing. So what are some of your initial findings from this analysis?
Yeah. So we're still kind of pulling all the records together, and my graduate students are entering in the data, and we're getting them from the dairies. But one dairy that we want to kind of share and highlight that we've delved into a little bit more than the other ones is a South Central dairy. And so we can't make any conclusions even about the dairy or about everything at all, like region-based or overall the impacts. But what we found is that when we gathered the information from January 2021 until they got HPAI outbreak in 2024 in March, what we observed for heifers is that they actually had about 5% decrease in their conception rates during that 2024 from March until December, but that appears to go back up in 2025. So it perhaps maybe was just a short term, but also interestingly with that is that for heifers, we saw an increase in services per conception, but they've remained higher. So on this one herd in particular, they went from, about a 1.5 up to like 2.2 number of times bred for their heifers, and it's continuing into 2025. And then for the cows, we did see a conception rate appeared to decrease in all of the lactations. But for the first and third and greater lactations, they seem to be going back up for their conception rates, whereas the second lactation seems to be kind of having a harder time getting back up. But if we start thinking about we're looking at these records in 2025, these second lactation are actually the first lactation when they had the outbreak. So if they were infected as a first lactation, it appears in their second lactation during this 2025 year, we're starting to see kind of a lag in conception rate going back up.
So interestingly, it seems as if perhaps a heifer, non-lactating heifer or first lactation heifer, which you might think would be more resilient to recover, maybe is having more longer term effects on at least reproduction as opposed to older cattle.
Yeah, which we found really interesting because, we didn't think that heifers actually got HPAI or that they would be impacted. And when we're kind of looking at the 2025, some of those heifers were actually from cows that were in their third trimester of their pregnancy. So that may be a contributing factor. There's so many moving parts in it that it's really hard. We're kind of still coming together with some of these things. And every time we look at something, I think we add another 5 things. I don't know, Dr. Piñeiro, you can probably attest to that.
Yeah, no, I just wanted to mention, echo something you said earlier. This is a research that is at the very early stages, and it's a retrospective observational study, right? So you really want to control confounders in research like this. So, this is just some preliminary, results, but from one dairy, but it's nothing that we could jump into conclusions right now. It's a research that is very important, and I applaud Dr. Spencer for leading this research. But at the same time, it has to be, taking one step at a time. And once they control for all the confounders, season, stratify analysis, and you can, remove all the confounding effects, we will know better. But this effect that Dr. Spencer mentioned, it was quite interesting. She showed me the result earlier today, and it was, from what I recall, they were, correct me if I'm wrong, Jennifer, but at 52% conception rate, and they dropped during the outbreak to 45, and the year after they came back to 50, right? So when you do research with studies like this, you're trying to establish association, and the ultimate purpose is to find a cause-effect association. But sometimes you can have associations that are not cause-effect. Something that is used, and I don't want to get too scientific for your audience, but there's something called Hill's criteria to determine if an association could be cause-effect, and there are like 10 criteria in total. One is biological plausibility. Is there a biological explanation why influenza H5N1 could decrease repro? Another one is, with the presence of the risk factor, with the presence of the exposure, is it affecting the outcome variable? And once you remove that, is the outcome variable improving? So in that sense, you will need to see a decrease during the outbreak and then an increase in that outcome variable, in this case, conception rate afterwards, which is exactly what Dr. Spencer was seeing. So in that sense, it's promising. But as you can imagine, as a veterinarian, Mark, you know that you have bull genetics that could have changed, repro program that could have changed, feed that could have changed, heat abatement technologies could have changed. So many confounders that affect repro that have to be controlled when you do these retrospective observational studies.
What's made it a little bit harder is like some of these like other factors, when we think about it, we're like, oh, well, what if they changed a breeder? Or what if they started using precision technologies on their heifers so their heat detection rate went up,
Priority IAC, the only company bringing the fields of microbiology and nutrition together and the first ingredient in animal diets. Priority provides a more cost-effective and easier approach to nutrition. We recognize that not all bacteria are created equal. The specific strain truly matters. Priority IAC selects unique strains to provide the best performance in animals, and that's why we call these strains smart bacteria. Founded by Richard Brunig, helping to improve animal health one herd at a time. Calving is the most vulnerable time for dairy cows. Hypocalcemia has a significant impact on herd health, milk yield, and profitability. That's why Protecta developed the patented calcium response technology, CART. With X, Zeolite, and Casta liquid, dairy farmers can prevent hypocalcemia before it starts. The result? Stronger cows, smoother transitions, and healthier herds. Protecta, powered by CART.
So Juan, I'm really glad you brought that up, because when you first started describing this, that was my first thought as a constructive criticism, right? And we do this all the time, is, okay, what are the strengths and weaknesses of a trial or some evaluation, and just that, and how often we need to use that information before and after, year over year, et cetera, but with caution because of all of those confounding variables. If we don't use that, we never think outside of the box and look for these associations. But also, we all have lots of experience of producers, herdsmen, veterinarians, ourselves using data and making some conclusion that is totally incorrect, right? But so I that's a really important comment and approach. Let me ask, because I'm not familiar of directly, the pathophysiology of the virus, but like IBR or other viruses, are there any known effects at the level of the ovary that could explain this, or is it still a who knows out there for this virus?
When this started in Texas, we didn't know what we were dealing with until March 25, that it was published, the first result, positive PCR results for influenza H5N1 from, I think it was 2 raw milk samples from hospital cows and 1 oropharyngeal swab from cows in Texas and Kansas. But before that, we didn't know. And so we were getting samples and trying to understand why are cows going down in intake and production. And we measured some inflammation biomarkers. We were measuring serum amyloid A. We were measuring haptoglobin, fibrinogen, and they were really high. Of course, those are positive phase acute proteins. In other words, biomarkers of inflammation. Albumin, on the opposite, was low, which is what you expect when you have an inflammatory response. The reason I'm making this introduction is that your question was, what would be the link between influenza H5N1 and reproduction? And I think this inflammation could, at least in a significant part, explain that decreased reproductive performance. Because if you will have this inflammation, number one, you will have decreased intake. We know from other research that was published that they can have 30, 50, or even more decreased intake. Then nutrients are, as Jennifer mentioned earlier today, diverted towards maintenance, survival, right? So the immune system, there's great research published from Lance Baumgart group, from I think the author was Videra, that cows with acute inflammation use, 2 pounds or more of glucose. I think it was in the first 12 or 24 hours. So it's something that, just like with any other systemic disease or a disease that could cause systemic signs and exacerbated inflammation, having a detrimental effect in reaper performance is something that we will expect.
Yeah, like the delayed cycling and even the oocyte quality, because they're shifting that towards, fighting an illness versus reproducing. So those eggs, the development and return to cyclicity or even embryonic loss are very well known to be associated with illnesses.
Very multifactorial, obviously, and still a lot to learn on the effects. Let me ask anecdotal chit-chat comments in the industry of effects on the offspring, the calf. So, heard some kind of crazy, what I thought crazy stories, what have you, but anything actually documented on cows infected during gestation? Obviously, there's various stages of gestation also, but anything you're seeing there from either data or even anecdotally?
Yeah, so that's one thing that we do want to look at is like the abortions, if abortion rates went up, if they're being affected kind of in that type of manner. There's a lot that I think we still need to do. Juan, what would you say?
Yeah, the short answer is I don't know. I'm not aware of any epigenetic effects. If you ask me, will it make biological sense? I will say yes. If they do have exacerbated inflammation during the last trimester, at least it's worth exploring. But I'm not aware of any data, peer-reviewed, published data.
Yeah, or even just like the antibodies, if the antibodies are present in the calves or anything. I haven't seen any research, but that definitely needs to be done, right? Because if they say nobody's gotten it again, right? Well, if it has reappeared or anything, maybe these calves have gained that immunity during gestation. So we're just not seeing any significant impacts. But it's a really good question, and it definitely needs to be investigated, I think.
So given all of this information, at least that what you have thus far, I would imagine you really can't make any specific recommendation or change, just obviously always attention to reproductive performance, et cetera, et cetera. Correct? Inflammation, that's always looking for ways to prevent, reduce inflammation, reduce transition disease. So I would imagine there at this point, nothing real specific to actually do, correct?
No. And even if there are, reproductive inefficiencies that happen, that can help with changing the management on like how many cows or heifers do you need to breed sex semen to. But, if they're increasing afterwards, how big of an impact is it going to be? But I always, tell people that reproduction takes a long time. So sometimes we don't see any effects until way later, and then we're almost kind of playing catch up, and makes it a little bit harder.
Just to expand a little bit on that is basically, and especially, for you all that are in Mexico or any state or country that didn't have it, of course, biosecurity first. And I know it's not as easy as saying it. Applying biosecurity principles are much more difficult, and sometimes we just can't. If aquatic wild birds, waterfowls are playing a role, there's so much you can do, to control every single aspect of biosecurity. But everything you can do from the cattle you are transporting and bringing to your dairy, trying to make sure that if you could be doing testing, from the visitors that you have, from your employees, if your employees are having backyard poultry as well, it's a discussion that the dairy farmer needs to have. Is that a real risk? And is that something that, they could be advised against of having backyard poultry and probably, that being a vector. It's, again, I know when I say biosecurity, I don't take it lightly. I know it's really hard to apply all these principles, but I think it's number one if you don't have it. And as you mentioned before, once you have it, we know it decreases intake in cows that are clinical. We know it decreases milk production. And we know that at least part of that is explained because of an inflammatory response. So as you mentioned before, everything else that could cause inflammation, try to control it so that at least they go through that outbreak with no any other co-infections, other additional stressors that will further decrease their performance.
No, great point. I guess all the best management practices overall to reduce the effect of any disease. Correct.
Mm-hmm. Correct. Yeah.
And Dr. Piñeiro, actually, he has some great videos that are going to be going up on like Ranch TV and stuff. And he has a lot of great material about biosecurity that he's worked on. So I don't know if anybody's interested or anything like that. He's got a lot of great resources and materials.
Better feed means better outcomes. This is why Lallemand Animal Nutrition, a global leader in microbial solutions, developed the Clean Feed approach. Lallemand protects your silage with research-proven forage inoculants, offering expert advice and services to maximize your investment and profitability. Their cutting-edge microbial solutions help boost feed efficiency and production, ensuring you are supported from field to feed out. Learn more at cleanfeedapproach.com.
No, I think that's a really good point because I recall many years ago when there was the foot and mouth outbreak in the UK. As a younger veterinarian in New York, I started to see some other industry folks, nutritionists and such, showing up to the dairy with like rubber boots, like a vet would wear, and I'd be like, "Oh, what's made you change?" And well, did you hear about this foot and mouth in England? And I'm like, well, yeah, but that's in the UK. Like, good that you're thinking about it, but we don't have it here. So great, you're doing this, but why now, right? So I'd like to think, here in Torreon in Mexico, we still have herds that are positive for brucellosis and some for TB also. So I think a little bit more of a conscious recognition that, this is a disease that is easily transmitted on boots by dogs, et cetera, and that control. I think when we have more eradication of diseases such as in the US, we lose some of that urgency a bit, right? Or no different than COVID in humans and mask use, et cetera. So I think, videos and other training educational resources can always be great. And then I think you're transport. Look at what was it, the first case in Idaho, I believe, was unofficial transport of animals. We see a screwworm in Mexico as it's moved north. Again, lack of some safeguards of animals being inspected as they move between states. And as that tightens, those cases are caught well before they come to another region. So I think a great point, Jennifer.
Mark, and you mentioned there's something that I wanted to expand on because you mentioned also TB, brucellosis, and the point that they have in common with also this disease is that they could be transmitted to humans, right? So that they are zoonotic diseases. So that's another part that I think is quite important to discuss in dairies that are either at risk of getting these diseases or do have them, to protect their personnel. And talking about personal protective equipment. And sometimes, we just think about coverall, boots, gloves, and that is used in dairies. But something that we also need to discuss and perhaps, use more is some eye protection. There's a reported cases of a veterinarian in Argentina that was doing a C-section of a cow with brucellosis, and he got some amniotic fluid in his eye and then lost his vision. So there were few cases of influenza H5N1 in humans, but there were a few, and some of them were dairy farm personnel working with hospital cows. So I think this is another important discussion that, dairy farm owners and managers need to have with their personnel. It's PPE, how we work with that PPE, where we wash those coveralls once we're done, making sure they don't bring it back to their vehicles and to their houses, or from their houses to the dairy. I just wanted to mention that as well.
No, excellent point. Zoonotic diseases. I can think of some zoonotic infections I've had over my career, and they're real, and there's that transmission. And as you mentioned, both directions, right? Humans infecting cattle with TB, for example, are documented cases in certain regions. So I guess always be alert. I guess, thinking back of foreign animal disease class in veterinary school, right? At least at some point in your career, for those diseases that are known, you've seen a case, so that not a real case maybe, but some videos or pictures, so that if you see that again, it's that oh wow moment of, okay, we need to be on alert. So when do you expect to maybe have enough data? The project, I would imagine 6+ months or so, or you got grad students that are chomping away at data to have something sooner.
Yeah, so they are definitely chomping at the data, and we've got some undergrad workers helping too, because it's a lot of data. We're shooting for 5 dairies per region at least, up to 10. So we're planning on submitting an abstract in February, so at least having a majority of the data ready by then, ready to go. And the grant ends, so our final report and our final publication will be out probably next June, July is what we're shooting for.
Cool. That's great.
If not sooner. Sooner would be better.
That's great. So we'll have to have you back on the Dairy Podcast Show to give us the update, say June and July, if not before.
Yeah, definitely.
Well, excellent. Really appreciate your time this afternoon joining us from Texas, Dr. Jennifer Spencer and Dr. Juan Piñeiro. And with that, I would like to thank all of our listeners, our sponsors, of course, to make this Dairy Podcast Show possible. And certainly, I'm sure if users have or listeners have any questions or really interested in some of this follow-up, they should look towards Texas A&M materials websites, and then some future publications for updates.
Thank you so much for the invite.
Yes, thank you.
For all of our Dairy Podcast listeners, have a great day.